To begin, I'd like to introduce Chief Dave Mowat, Chief of Alderville First Nations, to provide acknowledgement of the land on which we are meeting today and on which this mass immunization clinic will take place. Chief Mowat.
Good afternoon, everybody. It's a pleasure to be here. Thank you for the invitation. My name is Dave Mowat, Chief of Alderville First Nation. I'd just like to acknowledge that we are on the original Gunshot Treaty lands, now known as Williams Treaty's Clause 2 lands. And I want to just to say that these lands have provided sustenance and many a home for our people and for the settlers that came in, and we just want to be mindful of, while we are trying to contain this pandemic and the sickness that goes along with it, we also have to be mindful of Mother Earth and looking after Mother Earth, because when she gets sick, we'll all get sick. So with that, Chimigwech.
Thank you, Chief Mowat. Ladies and gentlemen, I'd like to start this afternoon's formal remarks by welcoming Premier Doug Ford back to Northumberland County. We've been honored to host the Premier on a number of occasions during my tenure at Northumberland Hills Hospital, and I believe he's being very well kept informed by our wonderful collaboration, about the wonderful collaboration that goes on in this county, thanks to our very hardworking MPP, David Piccini. As Warden Crate and all of the municipal leaders who are with us here today know, Northumberland continues to produce innovative partnerships to enhance coordination of local care and services. There may be no greater example of this than the one we've been so pleased to demonstrate to the Premier and his team this afternoon, this mass vaccination clinic. By leveraging our strong Ontario Health Team of Northumberland partnerships of primary care providers, community care, the county, hospital, and public health, as well as the ready and willing support of other partners you will hear more about shortly, the arena we are standing in right now will, starting tomorrow, transform into Northumberland's first mass immunization clinic for COVID-19. And I must say, Northumberland's commitment to get COVID-19 vaccine into arms is strong. Beginning with local residents 80 and up, rostered to primary care physician providers, this clinic, in only a few short days, with the support from the fantastic call center team at Northumberland County and the strong leadership of the Executive Director of the Northumberland Family Health Team, has already registered its first 2,800 patients. By signing up these individuals just prior to the launch of the broader provincial portal earlier today, it has been our aim to hit the ground running as soon as vaccine is available to us. And it is my pleasure to tell you that thanks to Northumberland's exceptional teamwork, the assistance of the wonderful town of Cobourg team here at the CCC and the local Rotary, we are ready to do just that. Many of the clinical team that you see here today have had a direct hand in Northumberland Hills Hospital-based clinic that was launched just over 2 weeks ago. And to date, that clinic has vaccinated over 2,000 of our highest and very high priority healthcare workers and first responders. We have taken this process, applied at NHH, and scaled it up. A simulation of the mass vaccination clinic has been taking place today, and as you can see, Dr. Emma Smith, Dr. Kate Everdale, and the whole team are ready and very pleased to begin the mass rollout tomorrow, and together with our public health partners, keep it running with a steady flow of vaccine. It is my pleasure now to welcome Premier Ford to the podium to share a few words about what he thinks about our setup and how it fits into the broader provincial rollout that is now ramping up under his government's direction. Premier Ford.
Well, thank you so much, Linda, and thank you, Chief. It's a real pleasure to be here. It's great to be at Cobourg Community Centre with MPP David Piccini, and I always say my MPPs are champions, But David, as I always say, you're an absolute champion, taking the bull by the horns and making things happen. To see this mass immunization clinic that will open its doors to the public tomorrow, I want to take a minute to thank the incredible team here who are making this possible. And I tell you, I travel around the province, and there's great communities all over. But Northumberland, they pull together, Cobourg pulls together like I've never seen before. As they were telling me when they were setting up, they had 300 volunteers. They put the call out there, and since last Wednesday, 300 volunteers. And this was an ice rink, I believe, last week, and look at the transformation. So I want to begin. I want to thank Chief Mowat. Again, thank you, the Alderville Health Services, and the entire Alderville First Nations. Mayor John Henderson, and Dr. Ian Gemmell. And I heard the story with the doctor. You know, he jumped in here halfway through the pandemic. And Doctor, I want to thank you for all the great work that you're doing. Gord Lay, Adrian Bell-Smith, Trish Baird, and Emma Smith. The Community Care, Northumberland's team, Northumberland Family Health Team, and the HKPR Health Unit. All the physicians and their champions out there, volunteers, and of course, something close to my heart is the Rotary Club. I had the opportunity, anyone who knows Rotary, the Cobourg Rotary Club stands out amongst many in Ontario, so thank you for the great work that you're doing. This is what I mean when I talk about Team Ontario, and thank you. Across the province, more than 150 mass immunization clinics like this one will be open this month, rapidly increasing our capacity up to 150,000 doses a day, depending on supply. And I mentioned yesterday at the press conference, we have the capacity to do approximately 4.8 million vaccines. Right now, we have the supply for about 1.4 million, so there's a big gap. This site alone can administer 800 vaccines a day. We need the federal government to ensure we have enough supply so these people can start getting 800 needles in arms every single day. And that goes for every region of the province. The infrastructure is in place, and I can tell you folks, we are ready. But we need the reliable supply to match our increasing capacity to deliver. Today, we have launched the province's online telephone booking system. And I'll tell you, we were all nervous when it went online, but so far, I've heard about an hour ago, they have over 45,000 people booked on the telephone line. They're taking care of approximately 375 people a minute, which is pretty staggering. From this morning alone, tens of thousands more Ontarians can now say they have an appointment. And this is great news. Everyone will have their chance to get vaccinated, but we're prioritizing our most vulnerable. That means getting Ontarians 80 and over vaccinated as quickly as possible. If you are 80 or older or born in the year of 1941 or earlier, or helping an older friend or a relative to book an appointment, you can visit ontario.ca/bookvaccine, ontario.ca/book/vaccine. Or call the 1-800 number, or 188 number I should say, 1-888-999-6488. Again, that's 1-888-999-6488 to set up an appointment near you. For Ontarians under 80, your turn to get vaccinated is on the horizon. And I just ask you, please be patient, and we're going to get to you. But we must protect our most vulnerable, and we will do so much more as soon as we receive the supply we need from the federal government. Folks, let's stay positive. We're seeing a bright light at the end of the tunnel, and together we will get through this. Thank you, and God bless the people of Ontario. Now I'd like to pass the podium over to my All-Star MPP, David Piccini.
Thank you very much, Premier Ford, for joining us here in beautiful Northumberland, Peterborough South today. That's staggering, 375 people a minute, and that's thanks to all the remarkable workers, volunteers, many of whom you see here today that make that happen. As the Premier said, this wouldn't be possible without the dedication and work from many, many community partners. Good things happen when we come together as community to get things done. Here in Cobourg and across Northumberland, Peterborough South, this is how we operate. They say many hands make light work. This is on full display across our great province, and especially right here in Northumberland County. To our municipal and Indigenous leaders today who've come to the table to work closely with our local health units to support this mass vaccination effort, thank you. To the many healthcare professionals and first responders who, on top of their day-to-day job, give of their time to make this possible, thank you. To the many Rotarians who saw a need and stood up with a can-do attitude, thank you. And to our local business leaders like Rona, Sabic, and Stallwood Homes who gave generously to make this behind you, thank you. You see it on full display behind me here today. And finally, to the many community volunteers who will work here and have generously offered to drive people to get their vaccine, and over 300 to date, we thank you. And I could not end without acknowledging Nancy Bruce's daycare children whose drawings throughout the centre put pictures to the many things we all can't wait to do when COVID is long past us. So to everyone watching at home or at work or wherever you are, please view today, behind me, right here in small town Ontario, as an example. Examples of which you likely see in your own communities. Arenas don't just become mass vaccination sites because we wish them to. Mass vaccination arenas, community centres, and sites like this across the province of Ontario exist because people from all walks of life came together to make it happen. People who've embraced a common purpose that is far bigger than our differences and come together to support an effort like the likes of which we have not seen in decades. So to everyone behind the camera and everyone here today, thank you. Thank you, and I'll now turn things over to Mayor Henderson.
Good afternoon. It is my distinct pleasure to welcome Premier Doug Ford to the community of Cobourg. It is also to extend greetings to our MPP from Northumberland Peterborough South, David Piccini, Linda Davis, Chief Executive Officer for Northumberland Hills Hospital, my special guests to the right of me, all Northumberland mayors, including Chief Moat representing Alderville First Nations, Cobourg Police Service, Emergency Service, Fire Service, and again Chief Mike Villeneuve, who leads our own Town of Cobourg emergency team. And again, a very special thank you to Rotary. I'm proud to be a Rotarian, and I welcome them. There are many to the far side of us today. Thank you. Today, however, is that moment. After weeks rolled into months and months rolled into a year, we have finally arrived. It's that moment we are now seeing the results of resiliency, lockdowns, safeguards, an influx of PPE, creating and improving safety protocols, along with constant community messaging and testing. Today is the day we are welcoming some of the most vulnerable to our own community center and asking them to roll up their sleeves and get vaccinated. Today, I stand before you in one of my proudest moments as Mayor, Town of Cobourg. I also stand before you humbled by the continued strength of our community has shown, and in the true support of the Ontario government's leadership and execution of the vaccination distribution plan. We are honored that our infrastructure was chosen to transform into a safe, secure immunization clinic. I would also like very much to applaud the efforts of our local health units, our hospital staff, Northumberland County, and the Town of Cobourg staff as they pivoted at a moment's notice to make all of this happen and possible. As we continue to navigate the many challenges in the pandemic that have presented with us and continue, I want to take away what we have gained, the will to adapt, the ability to take in the moment, because that is something worth fighting for. Thank you.
We'll go to the phone line for questions.
That's great, Mayor, and thank you so much. And I want to thank all the mayors here today. It's a team effort, but I want to give a special shout out to the emergency service folks that I absolutely love, the The paramedics are outstanding, the firefighters outstanding, and of course our great police. So thank you. Couldn't have been done without them right across our province.
Okay, we're ready to take questions.
First question comes from Randy Rath at CHCH-TV. Please go ahead.
How you doing, Randy?
Hi, Premier. I know that you want to put a sunny face on all of this, but we're getting dozens of calls today from viewers who say that when they go to the portal, they do everything right, and it comes back with a message that the form has been tampered with. And people are growing increasingly frustrated. There doesn't seem to be a technical support line. People are spending hours waiting on the phone for technical help, and it's generally perceived that this isn't going well. How do you respond to that?
Well, respectfully disagree. So far this morning, 45,000 people were able to figure it out, and I found out yesterday someone was trying to go in there in the trial and they weren't entering it right, but it was pretty user friendly, and we can, if that doesn't work online, then call the 188 number and see how that works. It's 888-999-6648. But that's what I'd do. But we've, you know, Randy, I'm going to be frank, we have some of the largest companies backing this up, from the IBMs to Amazons to you name it. They've tested this, and you know, I'm not a computer expert, so I shouldn't be speaking about this, but one gentleman was complaining adamantly, and he was putting the wrong, what is it, URL number or something? He was putting something in wrong, and he consisted doing it. But call the 1-800 number or 188 number, and they'll be able to help you. But I'm going to follow up, Randy, to see what issues, if there is any bumps in the road.
Follow up?
Okay, and I think I have to ask you about Sam Osterhoff. He has affiliated himself with a group that has compared abortion to the Holocaust. And, you know, it's not the first gaffe that Mr. Osterhoff has made. How many mistakes are you going to accept from him before you remove him as the parliamentary assistant to the Minister of Education?
Well, what I can tell you, everyone has the right to believe in what they want. I'm not one to dictate anyone's belief, but what I don't believe in, to compare abortion to the Holocaust, it's just wrong. Nothing should be compared to the Holocaust. That's unique. But I'll be speaking to Sam tonight.
Next question.
From Graham Richardson at CTV Ottawa.
Hi, Graham.
Hi, Premier. There has been some success today. I appreciate what you're saying, but I just want to reflect to you that what Randy says is happening in our region too. The form has been tampered with. Message is popping up. I just spoke with someone in Carleton Place, spent an hour and a half online, did all the right things, waited, and then was just rejected. So I guess the question is, how long will this hiccup last? Is it just today? Do you know? And when do you think it'll be fixed?
Graham, I can tell you as soon as I leave this place, you know who I'm calling. I'm calling our IT guys to find out. I just wish I could give you an exact answer. They just sent me a message that it's going relatively well. You're telling me differently. I'm going to jump on this. As we said, I was just praying all night this thing wasn't going to crash, because every other area in Canada, when you have a couple million people going on at once, it usually crashes. But we'll iron it out. We'll iron it out immediately. I can promise you that. They'll be all over it. Matter of fact, I would bet as they're listening to this, they're jumping on this. So we'll get down to the bottom of it. We're still going to continue booking people. And again, if you can't get through online, please just call the 188 number. I'll give you an example. As I mentioned yesterday, California has 40 million people. They have 1,000 operators. Quebec has 8.5 million people. They have 600 operators. We have close to 15 million people. We have 2,200 operators. And so the calls are coming in fast and furious. They're handling about 375, I heard, a minute, and we'll try to improve on all fronts.
Follow up?
And just on the other areas of the country, I've asked you this before, but people are still asking this. Across the river here in Gatineau, they're at a younger age already. Parts of the West are at a younger age already. And of course, vaccines are coming per capita. Ontario has a much larger supply of vaccines. Is it the target on long-term care and retirement homes that caused us to move through ages in general populations more slowly, or is it something else?
No, that's one of the aspects, and that was a good question, by the way, Graham. So when a lot of other provinces decided not to give the double dose to long-term care, and no province can compare to, we have about 74,000 long-term care patients. We decided to do the double dose. We've went through about 246,000 of them. We're deciding to make sure that we secure that the doses for the people in long-term care and the frontline healthcare workers that are working in the long-term care. And the good news is, we're down to 0 mortalities. Every day I'm looking at it, we might have 1 or 2, which in my opinion is too much. But compared to where we came from, I'll tell you, that's good news when we see 0 mortalities in any long-term care, and we're going to get through it. The other area, that's why I never go by percentages. My good friend out in PEI has 200,000 people. They can get vaccinated the whole province pretty quickly. There's no area like Ontario, and the size of the jurisdiction is equal to Quebec. But we have almost double the population, and we're going steam, just full steam. We don't have the tens of thousands of vaccines sitting in the freezer. I think the last count, we ended up getting Moderna on Saturday. I think about 160,000 thereabouts, and you minus that, minus the AZ, AstraZeneca. We were left with about 120,000 vaccines. If we can average about 50,000, they're gone in 2 days. The bottom line is, we can output 4.8 million a month. We have enough vaccines for 1.4 million. So I'm begging the federal government, please get more vaccines to us, because we can't keep. You see the operation here. You can see it here. You can see it. Vaccination centers all over the province, the big ones in Toronto. It's like any production line. I'm a business guy. You can't ramp up a production line and have it going full steam, have all the great frontline healthcare heroes and the docs putting needles in the arms, and all of a sudden bring it all down for a day, ramp it back all up again. It's a massive undertaking. We need consistent supply of vaccines. That's our challenge right now.
Next question.
From Chris Rushoe at the Toronto Star. Please go ahead.
Hi, how you doing?
Thank you. Thank you, Premier, for taking my question.
Thank you.
Last week, General Hillier said that all adults would have a first shot of the vaccine by June 20th. Yep. So you now have mass vaccination clinics up and running, but you've also expressed concerns around the supply from the federal government. So I'm just wondering if that is still the target date. It might be sooner or might it be later, depending on supply? So
General Hillier, by the way, talk about a champion. He's absolutely incredible. What he did say is exactly what you said, sometime in the middle of June, based on the supply of vaccines. So we're concerned. We're always concerned. If we get the vaccines that are required to get everyone who wants a vaccination done, then we will be done sometime in the middle of June for the first shot, right across the board, to the exception of long-term care. We're giving a double shot. Then we'll start moving forward. But as all the docs have said, and I'm sure the docs behind me will agree, if you take AstraZeneca, or actually any 3 of them, it will keep you out of ICU, it will keep you out of the hospital. And that's our number one concern. And then, by the way, General Hillier, he's done such a great job, heading all this up. We only get to keep him for a couple more weeks. I think I'm going to put a ball and a chain around his ankle to keep him, but his OIC is running out, and I try to get him to renew it. But as he said, Doug, I did the job I came for, and we got everything set up. And now, as I agree with him, we have all the confidence in communities like Northumberland or communities across the province to take the bull and by the horns and just run with it. So again, a special shout out for General Hillier. I'd have that guy on my team any day, all day long.
Follow up?
Thank you. My next question is actually from my colleague Noor Javid, and it has to do with ministerial zoning orders, and in particular the decision by Amazon to abandon its plan to build on the provincially significant wetland in Durham region. So she's wondering that we've seen a lot of backlash to the MZOs from both residents and businesses, and wondering if your government is considering removing the rules that allow these to override all planning policies.
Well, the only MZOs we issue, and I'm going to reinforce this again, I keep saying it, is if we get a letter from the region, in the case we did for the Amazon site, and the local mayor and council. Once they give us a letter asking for the MZO, then we issue it. So with this MZO at Amazon, since they're moving along, we're going to sit down with the region, we're going to sit down with the mayor and ask them what they want to do with it. But all I've ever said is one rule. Outside of the Ontario-owned properties, and there's not a lot of those, but if you want an MZO, and I'm speaking for Northumberland, if they get approval from their council, their region, and the mayor, let's get it done. And let's talk about MZOs. A lot of people don't even know what MZOs are, municipal zoning orders. And what it does is, as we come through this pandemic, guess what the number one issue is going to be? Is the economy. And we can't afford to wait. In some cases, some municipalities are a lot quicker than others, so I don't want to clump them all together. But in some large municipalities, it could take 2 to 3 years on all fronts, no matter if it's housing. When 40,000 people a year, one of the fastest growing regions in North America, are moving out to the GTA area and beautiful places like Cobourg, do you want to wait 2, 3 years before the approval gets ready? So a big company like Amazon wants to come. I can tell you, I talked to a company, I remember this conversation, I think it was last year before this pandemic, said, Doug, it's going to take us 4 to 5 years by the time we get approval, and we aren't going to invest, tens of millions of dollars into a region that you can't even get a damn permit when I can go down to Ohio and get one for 6 months. So folks, we're competing against other regions around North America. Either my great friends down in the US, like the Ohio, the Michigans, they're getting our jobs, or we need to pick our socks up and start approving these permits, not only for businesses to thrive and grow and prosper, but for people to be able to afford a home. You see what's happening in the real estate. It's ridiculous. And I used to say, young people, like my kids, how can you afford a home when you're starting out at $1 million some odd dollars? So people are moving out of the city, and we need to start providing homes and making sure the time frames accelerate rather than sitting there. But remember, I came from the municipality, and I can tell you, it's a nightmare trying to get a permit, through the system. We should be able to get those permits, bing, bang, boom, get the housing, get businesses, and start rocking and rolling. That's what we need.
Next question.
From Chanel Call at CP24. Please go ahead.
Hi, Chanel.
Hi, Premier, for taking my question. Thank you. I will start with asking you about the portal. I know you're telling people now who are having problems online to phone in, but some of our viewers say that they've spent hours on the phone today on hold, and then they're told instead to phone their local public help unit. They're also being told, some people, that they need an invitation code when they phone the online bookings, or when they phone into the booking system. So can you tell us whether you've heard anything about these problems and sort of what the plan is moving forward to fix these issues?
I'll look into it. Again, I came right in here. Haven't had an opportunity to talk to the team. As I said yesterday, there might be a few bumps in the road. Vast majority of calls that are coming in, 375 a minute. We're answering them as quickly as possible, booking the appointments. So far this morning, over 45,000 people have been able to get through on the website. But make no mistake about it, if there's bumps in the road, little wrinkles in the system, I will assure you we will have this taken care of immediately. Matter of fact, I feel like picking up my phone right now and getting you the answer. But we will get back to you, I promise you. But am I shocked with the volumes? No, I'm not shocked. I'm just very grateful that the system never crashed. That's what I'm shocked about, actually.
Follow up?
Okay, thanks,
Yep,
Premier.
thank you.
Also want to ask you about vaccine clinics. Is there a reason these clinics aren't running 24/7 at the moment? And is there a plan to eventually get there?
Absolutely. So it's due to supply again. If we run the 24/7 in some of these large vaccine centers, they're going to run out. And I've asked all regions, especially in the larger regions, to make sure that we don't have one 24/7, we have multiple 24/7 vaccination centers to make sure they're going. Plus, just think of these numbers. What's going to be one of the big saviors? So we have over 300, I think it's 360, somewhere around there, pharmacies out there, and had an opportunity, talked to a couple, talked to the CEO of Shoppers. One pharmacy went through 500 in less than 24 hours. So we have 3,200 pharmacies ready to go, waiting for vaccines, and say they did 100, forget the 500. That's 320,000 a day. Those are staggering numbers. And let's even be conservative. Say each pharmacy does 50 a day. That's 150,000 just with the pharmacies. I'm being super conservative when I say 150,000 a day. Plus, we have the mass vaccination centers, we have the mobile units, and we have the doctors, physicians that are doing it as well. It's all hands on deck. There's one missing part. We need the vaccines. Simple as that.
Last question.
Yeah.
From Valerie McDonald at News Now Network. Please go ahead.
Hello, Premier.
Hi, how you doing?
I wonder if I could ask you, if I understand correctly, you say we have 1.4 million doses, but we need 4.8 million monthly. Is that correct?
Yes, that's the figures roughly that we're looking to receive, the 1.4, and this is about monthly figure. Now, if we ramp up and we get millions and millions of them, then it'll change. Now, they are promising us, let me just go on record, they're promising us moving forward. This week we aren't going to get much, but the following week I hear we're going to get a million moving forward every single week, so that's going to change the game. But as of right now, that's what we've received, approximately.
Follow up?
And yes, I'm wondering, because I'm an optimist, if the vaccine deliveries increase what is expected, will there be a change then in that 4-month period between the first and second doses?
Yeah, that's a really, really good question. The quicker we can get the first dose done, the answer would be yes. If we can continue on with the vaccines and more coming, I'd love to get that J&J. That's a one shot, bing, bang, boom, you're done. So hopefully we can get some of that J&J in here. And they're everyone's trying. First of all, I got to tell you something. The federal government's trying. They're doing their best. Everyone, the municipalities are phenomenal. The province, it's all hands on deck. Everyone's pitching in. I'm so grateful to the frontline people that are dealing with this day in and day out. Again, hospitals, paramedics, fire, police, docs, nurses, PSWs. I could go on and on and on. They're incredible. But you know what's really more amazing? Every community I go to, it's the community that has pulled together. When they told me here in Cobourg that as of Wednesday, they put the call out and 350 people, and that's just the beginning. It's unique here, I can tell you that. I've never seen a community like it, and I learned that well before I became an elected official when I came here through Rotary, and what an incredible Rotary Club they have here. But that just says everything about the community. We're a bunch of champions here.
Thanks, everyone.
Okay, thanks, everyone. We'll get those issues taken care of, but don't let it deter you. Keep calling because we're going to keep booking people. So thanks, everyone. you doing, everyone?
Good, sir. How are you?
I'm doing well. Hi, how you doing?
Hello.
Great. First of all, thank you for the great job you're doing.
Yes.
Fantastic. I appreciate it.
Welcome to our clinic. This is Adrienne Bell-Smith, and she has been instrumental in getting this organized. So she's going to walk you through what has been happening.
Absolutely. Okay, so we are so excited. We have so many partners that have come together to put this clinic together. We're going to walk you through what it's going to look and feel like for the patient. We have our 80-year-olds, starting 80 and over, starting to come through as of tomorrow.
Oh, great.
So when they come, they'll enter the ice rink down at the end, and somebody will make sure that they're in the right place at the right time. Before they even get out of their car, the police officers are going to screen anybody for COVID symptoms. So we know that anybody who's not feeling well isn't even going to enter the building. They'll be turned around, instructed to get COVID testing if they need it, and where they can get that. So once that's done, they come in, they wash their hands, they're checked for masks, they enter the ice rink, we know who they are, and then they'll be directed towards these 4 lineups in front of each of our pods. So we have the different pods here. That the beauty of the pods is that this is going to let our patients receive the vaccine and recover in place without moving. So they don't have to get up and walk somewhere. They can stay right where they are. So let's see that.
We also have Dr. Emma Smith, who is one of our family physicians, and Dr. Kate Everdell, who are assisting us today, and I'm not sure who our person is here.
So we have Michelle, and she's with the health unit, and help them with their code if they need their code taken off and get them all ready. And then our data entry assistant is going to check our patient in.
Good afternoon. I'm Michelle. Can I get your first and last name, please?
Yes, it's Helen Lackey, L-A-C-K-E-Y.
Wonderful, thank you. And your date of birth, please?
June 30th, 1936. Thank you.
So I just have to ask you a few questions to make sure that you qualify, okay? So are you feeling well today?
I am.
Great. Have you had any vaccinations in the last 14 days other than a COVID vaccine?
No.
Good. Have you ever had a severe allergic reaction in the past or needed an EpiPen or a trip to the emergency department for an allergy?
No, I haven't.
Great. Do you have any autoimmune conditions or take medications that affect your immune system?